Welcome to another episode of the Tobago House of Assembly's Post-Executive Council Media Briefing. This week, the Secretary of Health, Wellness and Family Development, Dr. Agatha Carrington, addresses the media.
Firstly, let me just say that the Executive Council, led by our Chief Secretary, Mr. Kelvin Charles, as we set out and we charted our course, there were some important areas that we committed to do, and one of those key areas felt to how we will transform the health sector to make the health sector the preferred destination for healthcare delivery on this island. And I would want to share with you particularly some things that I expected to happen. You will recall last year, in September 2017, we agreed to establish a community residence for children with oversight and monitoring by the Facilities Review Committee for Children, as well as the Children's Authority of Trinidad and Tobago. I am pleased to say that tomorrow morning at 11 a.m. we will fully commission and launch this service. So that is August 23rd at 11 a.m. In terms of where the facility is located, it is at Canby Connector Road in Lambo. Let me just say that this underscores our commitment to provide support to our children at risk, children and families at that. Residents to this facility, the ages would range from 1 year to 17 years of age. And this home is unique in that, one, there's none other like this on the island, may I say. This is now available, and the population will be pleased to know that our children who are at risk, there's a place to which we can take them. Remembering, of course, that there are guidelines to be followed in terms of those persons who will be placed there. You may know that we have a probation hostel, but that the probation hostel takes care of those residents who have been sent there by the courts. These children that we now have are children who are at risk and who have been placed or will be placed at that facility. In the interim as well, let me just say this residence is providing and filling a gap, I think, as a support center for those persons that hitherto, or as the Children's Authority come on board, they will require a support center, and our facility will serve both as a community residence for children and a support center for children. The second thing I want to inform you of, you'll recall, I think about a month or so ago when I was here, I indicated that the Executive Council approved the procurement of the Moriah Health Centre by UDICOT, or on our behalf, to the tune of $25.8 million. I'm pleased to report that on Monday 27th of August, we'll turn the sod for the start of the construction of this facility. The persons or the residents of Moriah and environs will benefit substantially from this new facility that is to be built. Continuing as well in terms of a delivery mode, on next Tuesday, the 28th of August, we expect to launch fully our stroke and diabetes center and our foot and ankle center. This is going to happen at 3 p.m. on the same date, the 28th. It is located at the Old Fort at Quarters 45. That's the facility that we will now provide for those persons with strokes, as well as persons requiring foot and ankle care. This is very important for us, notwithstanding the fact that we do have prevention efforts in our primary care centers, and notwithstanding the fact that we have some services at hospital and the Scarborough Health Centre, and notwithstanding the fact that we continue to encourage persons to take full responsibility for their health, we still have an average of 11 strokes per month, and therefore we need to provide support for those that are already stricken by strokes while we deal with our prevention efforts. So that is a significant service for us. In addition to that, a foot and ankle service, which is the first one we've had on this island. And may I say as well, there's not a foot and ankle center in Trinidad as well. We are going to be launching that same service. What that will do is provide services to persons with diabetic feet, so diabetes will affect a person's feet, and then we'll have services provided. But more than that, the persons requiring any remedial work coming out of any orthopedic intervention, we will have services provided for them. Let me just say that there are strict criteria that will be accessed so that persons can have this service. So you don't just walk off the street to come in to have your foot and ankle dealt with. The team will be assessing persons at hospital and determining those persons who will most benefit from the intervention. So too persons with strokes, they will be assessed, and the team will determine, following a stroke rounds, that will happen. These services are critical for our population, and we expect to deliver them once weekly while we deal with some of the maintenance arrangement in our other facilities. Let me just say as well that while we speak to some of these things that we are going to launch in the next few days, I would want you to also save some dates for us, because these have already been agreed to and will be rolled out in the coming month. So that in the month of September, some things will be happening. We agreed last year to enter into MOUs with Family Planning Association of Trinidad and Tobago to strengthen our sexual and reproductive health services. And that is to be signed off in September. So too, our collaboration with Children's Authority for Children at Risk, that too is to be signed off in September. And continuing in our delivery mode, we will have and host our graduation ceremony September 12th for caregivers who would have been trained in care of the elderly and just completed differently abled training. They will have their graduation. In terms of infrastructure, what we'll be doing for September, we will be starting the upgrade and refurbishment of the existing Moriah Health Centre, and that is commencing in this month. Let me just say as well, our big one for September as well, on the second Saturday in September, as we do each year, our Caribbean Wellness Day will be hosted. So all of the Caribbean will be focused on wellness on that day. And in October, I encourage you to save these dates, because October 1st, we are going to be celebrating the International Day of Older Persons. October 10th, the World Mental Health Day, will be hosted by the Tobago Regional Health Authority. October 11th, the International Day for the Girl Child. That will also be happening, as well as we will cap off October with World Sight Day. Let me just finally say to you in terms of our delivery, and you may note that a lot of things are going to be happening and will be happening for us as we go forward into the start of the next fiscal period. With our focus on women's health, October 30th, our breast health and pink room would be launched. So too on November 19th, on International Men's Day, we will launch our men's health service and blue room then.
Firstly, let me just deal with the recent events, hurricanes and earthquakes that we have. Could you tell me possibly if the Exec Council would have discussed any plans in terms of us being in the midst or approaching the hurricane season, and also feeling the earthquakes that we felt yesterday, with the experts and authorities also warning that to expect more in the coming days?
All right, so let me just say what happened yesterday, because and you would know that TEMA has a specific responsibility for leading the charge with respect to that. And yes, that was discussed as part of what we discussed today. We in Tobago, we are not waiting for this to happen to plan. There is already a plan. And may I say that TEMA visited our hospital and looked to see whether there was any damage that one could see. I too checked to see whether there was any patient or anybody presenting from injuries, and we had no reports of that. In terms of the hospital itself and its preparedness, we, regardless of whether you have an earthquake or not, whenever an event occurs, we have an NOC that is kicked into action in terms of responding. May I say as well, last night we did not particularly respond to assemble the NOC, but that we did so remotely in terms of checking on different things and see how ready things were. But we did not assemble as we would normally do at a point at hospital.
Okay. Is that because the reports in itself weren't as severe, or?
I think persons, there were persons who had some discomfort. Many persons might have been intimidated to come out, I guess. But albeit our important response in terms of if persons were to present, our response in terms of care, that was in place.
Okay. Well, listening to the national media this morning and also listening to some of the reports, some government offices like the NIB nationwide has been evacuated, and a few other government offices. I'm not sure if we have done that in Tobago, but what I'm going to ask is the THA in itself would have the highest employment of persons on the island. Are you at liberty right now to share any plans just in the event that to probably your staff or the workers themselves, what may be some of the advice or tips that you could offer them in case of?
Well, but let me just say what I would have done as secretary, because there are standards and responses. So we shared remotely to key persons in our division. What are the things you do when something like this occurred? We did that internally, and I suspect most of the other divisions would have done that. So that people are reminded in terms of how they deal with that. But I don't know that we could have done much more yesterday, apart from notifying as far as was possible, because at one time the system was not as efficient in terms of communicating, but we circulated that so that you know how things that you must do, things you must be aware of.
We know that the first responders, you all are not the first responders. You know, TEMA and the Army Reserve and so on, these would be the guys of the first responders, but health and wellness definitely would be the catchment of if things really go wrong. So I don't know if you...
And I did say to you that one of the important things we did was to check to see if there were persons coming in with injuries, and I checked myself as well.
Yeah, definitely. I was just hoping if you could use this time in any way at all to probably pass that information on to the public, because in speaking with members of the public, not many people are aware what they're supposed to do, which centers they can go to, or what can happen. And
in terms of if you are ill, if something happens.
Or disaster, something happen or anything at all.
So let me just say to our Tobago and Trinidad and Tobago population, in terms of our responses, if persons were to be injured in any way, we do have our extended hours, and that as of yesterday, considering the time it happened, we would have had services available in Roxborough, Canaan, and Scarborough up to 8 p.m. Anything that is beyond the capability of those units would be transferred to a hospital, and if all our staff were on duty to respond as is appropriate, so that because our services are 24 hours, we never shut down at hospital, so that is available. Primary care, as I said, there are 3 centers open up to 8 p.m. And so we encourage persons, if they are injured, if something were to happen, and that you are injured, you go to your nearest center, and those centers are the ones I described. And further to that, you come to hospital, where we will provide all the care you require.
You mentioned that the services that are being provided will be delivered, is it once weekly?
All right, so the stroke and diabetes care at that center, and let me just tell you how it will operate. The team would come in, a full team is providing the service. So they go into the hospital, do the stroke rounds, and determine those persons that they will work with. And those persons will be sent to the center, and the team of speech and language, the physio person, all of those occupational therapists, they all work with those persons that will be referred to the center. So that team is selecting from the group of persons that will benefit most from the service, and they come to us at the center. It's not possible to do a stroke round each day of the week, so that it is going to be done on one day and you select the persons. Further to that, we'll have, as we start up, we look at and determine the maintenance arrangements that the team will be providing there. So very, very, very likely that further to the determination of the persons who will most benefit, the schedule may be adjusted. But we are starting with an assessment 1 day a week to determine what the numbers are, and thereafter we deal with the service to be provided.
What I'm trying to get at is, in terms of the treatment, you said that, so if someone is having their feet treated, if they have if they have diabetes, and you're treating their toenails or whatever it is you're doing, or you're doing massages, is that going to be done in the same day as seeing the physiotherapist? Are all of these services coming together on the same day?
No, let me just explain. A stroke round will be done by a team of a multidisciplinary team, and they determine what is going to happen with patient A. They are sent to the center, and the care will commence there. In terms of the scheduling of what will happen for that particular patient, that's going to be determined when you get to the center. But we have a team that would go in once a week and do that and have the patients come in. The maintenance arrangement will fall to a schedule determined by the team and the urgency of the matter, what the needs of the particular patient would be. But let me just say as well, so the center is open and we have maintenance staff, but you will not have assessments taking place each day at the center. They go to hospital, they do the assessment, and they go over to the center. They will then determine whether your treatment protocol is going to be twice a week, once a week, or the like. But our assessment from the team happens once weekly.
Could you say if treatment for diabetics and stroke patients are going to be done on the same day, or is that something that's going to be scheduled?
It's going to be scheduled. We'll have maintenance services in the center every day. However, the team that will determine what happens with your care, that will happen once weekly.
In terms of the patients who are coming down, could you say if there's any sort of assistance for them to be transported from where they are? Because we don't know what conditions some of them are coming in. If they are amputees or so on.
The criteria for the selection would be determined. That all those matters fall to the team. So you may not find, remember we still have services at hospital and at primary care. And so those that will benefit most from the interventions are the ones that will go to the off-site center. So you still have services at hospital. Assuming that you are inpatient, you will be managed at hospital. By the time you're discharged, if it is determined that you will benefit most from that service, you will be sent to the center for further management.
What I want to get clear, though, is that a patient may have to go to that center more than once a week.
It's an outpatient service, yes?
Yeah, you did mention that they may have to come more than once a week. So I want to know if there's any assistance, like a shuttle service, for them to get there, or is that something they have to do with themselves?
Yeah, they will have to, because this is an outpatient. This is an outpatient service that is being provided for persons requiring. The state has not made any arrangement to transport, because understanding that I'm saying that there are 12 patients, average of 11 or 12 patients per month with strokes. So that those who would most benefit would be the ones that will go there. But to ask that transportation be provided for persons throughout the island is asking, because they normally will come to hospital for care. If you're coming to your outpatient clinic, you go there. You're not provided with transport to come. We transport persons when there are emergencies. You transport if something has happened and the ambulance is called and that kind of thing. That is done. However, outpatient means you should have some stability enough to be able to either be brought or you might be able to bring yourself to the center.
There's been some complaints with regards to not the hospital in itself, but in terms of commuting and getting to the hospital for the patients. There's, I don't know if you're aware, but there's a major problem with the Signal Hill stand, which really has seemed to be neglected for many, many years on hand. There seems to be no plan of procurement to have a proper or authorized taxi stand to reach the hospital or for the Signal Hill and Patient Hill environs area. In a matter of fact, some of the taxis are actually used by chefs for that to happen. And when the police are in town, you definitely get no transportation for sure, because it would be a charge to those who are plying the trade. And what is left is that you'd have scores of persons trying to get to the hospital, elderly persons in particular. They would obviously feel the brunt of it, and those who are more or less need the support, and probably standing is probably a little bit more difficult. So I don't know if you know about it, or if you could address it or anything.
Well, I can't address it directly. However, I would undertake to raise that with the respective secretary. So there's a secretary with responsibility for transportation. I would raise that, as well as the secretary for works. I can raise that as well. But in whichever way it falls to us to assist, we will be willing to do so.
Any timelines, any possible timelines?
Well, I can't, because this issue, as I say, does not fall within. I'm just undertaking to highlight that to my colleagues with the expectation that will be addressed. And I'm just saying as well, there's a commitment when something falls to us to do, that we will do so.
All right. I was just trying to stress the importance of it, which I'm sure
yes,
you
I
understand.
Right?
I
understand.
Yeah, and my final question is, based on the statistics we got from the United Nations and some of the global health authorities, is a topic that has seemed to be sort of watered down over the years. That is the occurrence of or the prevalence of STD and HIV and that sort of thing amongst persons. Also, I got some statistics from some doctors, not breaching anybody's confidence or anything like that, but the statistics that we would have gotten would show that there is a major rise in diseases, sexually transmitted diseases, which especially there's major concern with the age bracket of those school children. I know we had a couple programs. I'm not even aware if we still have them, but do we have any programs, outreach programs, to deal with it? Because, as I said, it's something that has people sort to become desensitized towards it. And
I don't agree. One, the question has several prongs. Several prongs is very difficult to, in terms of how you convey the question. Let me just say firstly that to say to me that STDs, there's a rise in STDs across the board, I don't have that data, except you could disaggregate the groups. For me, I have a difficulty.
In terms of the age groups, or
no, in terms of the STIs.
The STIs.
Which ones are you seeing arising?
I wouldn't, it was just a collective, because what happened is that I would have done investigations with some of the medical laboratories, and some of the authorities themselves would have admitted that the reports that they would collect, which you also would have said publicly, the reports that would be collected is only those that could be submitted. So it wouldn't actually be a factual. Right.
So that, and I'm just repeating what you would have said. So you say that this is so, but you are also asking whether, how are we dealing with those in terms of health promotion and disease prevention?
No, I'm asking if we would have those and whatnot, because as I said, it would be.
If we have those services?
If we could just.
Yes, we do. We do in our health promotion and disease prevention efforts, moving and pointing towards healthy lifestyle. Those are captured in terms of what we do. Those are indeed captured. So we provide health promotion, disease prevention, and we provide treatment and care. When we determine whether you have a condition, we provide treatment and care and support as well. We do. So the entire continuum is catered for in the service.
And with relations to, is there any one of these particularly targeted towards the schools? Because that would be the major concern right now. You
would know as well that in terms of the curriculum and all of that, may I say to you that health and family life education is an important area that fits within, and that there is an opportunity for us to do more. Work has been going on, but you would realize that one has to be careful in terms of what is conveyed if it is not part of the curriculum of the school. Let me just say as well, in terms of my own exposure, because we've been looking at health and family life education and looking to see how we can have that much more integrated in the delivery of teaching and learning in our schools. So that is happening. To give you the data now, it's difficult to give you that, but that these activities are in progress.
We have teen pregnancies, and most likely by adult males. And what will happen is that, we know it's not the division alone to intervene in that, but of course it will be the authority. With regards to the teen pregnancies, there's that occurrence, but there's a disconnect with regards to there would be adult males who would be having sex with the young girls, and there seems to be a disconnect whether it is the parents actually taking responsibility in presenting the case, because it is a charge.
May I say so with the greatest of respect that the matters with respect to adolescent health is part of our remit. You may or may not know that we have a child and adolescent center. We also have our program for adolescent mothers. Some of the things we do there, so I'm treating just with that now, because we try to deal with, much as we have tried, let me say that, to deal with prevention efforts in terms of encouraging persons as to how they must behave. For persons who have some challenge with that, we still in the first year, when you've had the baby, we give you support for 1 year. While you are there, we try to empower you that you will have maybe just that one baby, and we provide you with some training in other skills. So apart from numeracy and literacy, we also provide you with the ability to do some things, whether it's hair or skin or whatever, and to be computer literate and so on, so that you can leave us in a year. The expectation is that we don't have you a second time. So we've not had persons coming back. Right. Well, the program doesn't cater for you for more than a year, because we have to fund as well the care for the baby. When you bring the baby to us, we provide a caregiver while you're at school, and we do that for 1 year. In terms of the Child and Adolescent Center, the interventions done there for those mothers, those teen mothers who might be at risk, we have strong counseling support at the center. The thing, though, I don't know we could legislate that you come. You can't say come to us. It is not that type of service. We can't. But that if you do present, we provide you with the support. The expectation is that we are able to intervene in your situation to make a turnaround.
Right. That was actually the question I was getting at, because I know all the information that you presented, and from speaking with persons, I know that there's only so much that the authorities themselves can do. But I remember that the major problem was with regards to intervening, the intervention stage, because as I was pointing out, you would have the teen mothers, and then you would have the adult males who would be the fathers of the teen mothers, but something you would just have the mother and the child and no reports of these things happening, and I just want to know if it was still a challenge, if it was still
let me just add, in terms of, I mentioned that our issue with respect to our men that we've not been addressing adequately. It is a gap with that, as with many other areas. So just as we don't address abuse from the side of the male, the same thing. It's true for that. But we are saying that we have taken that on board in terms of our interventions, and you would soon see from our men's health efforts and so on, we would not just be doing men's health, but we will do issues that concern our men. So that when we launch the facility on November 19th, you would see that for the first time, we will now have a service that is going to be dealing with, so it's not just when you abuse, we move you and take you to a WeTech center, move the woman and the children, but we will address matters with respect to the men as well. So we know there's a gap, and the commitment is to see that we fill the gap.
Thank you for staying with us for the Tobago House of Assembly's Post-Executive Council Media Briefing for the week ending August 25th, 2018.